Hello, my name's Sian McLaughlin. I'm one of the midwifery lecturers at UWE and the midwifery admissions tutor for the undergraduate programme. I'd just like to take 15 minutes or so just to talk to you about our programme here at UWE so that you might have some more information if you're considering coming to study with us. So first of all, why UWE? Well, in 2018 we were awarded gold in the government's Teaching Excellence Framework, which is obviously something we're very proud of and demonstrates our commitment to the best teaching and learning that we can provide right across the university. We're in the top 10 in England for student satisfaction and currently 28th in the Guardian League table. Glenside campus is where the Faculty of Health and Applied Sciences is based, and as you can see from the pictures, it's a really beautiful campus, a lovely place to work and study, and you can walk the entire perimeter in less than 20 minutes if you need to stretch your legs at lunchtime. The exterior of the building doesn't really reflect what's going on the inside. It's a beautiful building with lots of character, and inside we have state-of-the-art simulation equipment and areas for our students to learn in. We have ward areas, birth rooms, we have areas where critical care can be taught, and also on campus we have a 3-bedroom house that we make quite a lot of use of in the midwifery programme, making sure that our students are really familiar with midwifery, not just in the clinical area but outside and in the domestic setting as well. And in year 3 we take our senior students over to the house to look at how they might manage emergencies in the domestic setting and how they might manage both in birth situations and in the postnatal situations as well. Bristol is a really vibrant and cosmopolitan city which our students really enjoy living and studying in. It has a really diverse population, and students who are in practice in Bristol get a lot from caring for women from different diverse and ethnic backgrounds. So why study midwifery with us at all? Well, we have a very clear philosophy about midwifery and about how we want to teach midwifery to you. There's a team of really passionate staff who deliver all of the teaching. And as you can see from these pictures, in the classroom and in the clinical simulation area, our focus is to provide a very student-led curriculum. We utilise inquiry-based learning, and students work in learning sets throughout their 3-year programme to work together. And inquiry-based learning is designed to give students something to inspire them to start discussions. The students then start to determine what they want to explore within that topic, and we support them over the period of learning, which is usually around a week, with lectures and seminars and tutorials, so that they can start to answer the questions that they've formulated. And at the end of that period of time, they come back together to produce their feedback and share it with their peers and with members of staff. That's really important to us. We're trying to produce great midwives at the end of the day, and we want to support you as you move into practice as registered midwives. It's important that you're able to know where to find the answers, that you are able to continue learning as you go out into professional practice. We want help to create midwives who are dynamic and excited by practice. They're not just receivers of information. Actually, they're part of the agents of change in practice, that they're still inspired and passionate about midwifery. And that's the entire philosophy that we bring to our undergraduate programme. So we spend time in the classroom and also time in the simulation area, as you can see. This is a picture of some of our senior students learning how to deliver maternal critical care, which is something that can be quite daunting for students, and it's brilliant for them to be able to have the opportunity to practice with us in university in a safe space where they can sort of look at the tasks they need to do, think about their communication, their clinical skills, all bringing it all together before they go out into clinical practice and work with women and their families. So as I said, we've got a team of really passionate lecturers who provide the teaching here at UWE. Between us we have something like 350 years midwifery experience, and we've come from all different walks of practice. And we're here to really work with our students in order to produce the most exciting and collaborative curriculum that we can. So we work very closely with students in the design of our curriculum and the delivery of it. And we really cherish being part of that midwifery community within the university. So how do we prepare you for a career in midwifery? You spend 50% of your time in practice and 50% of your time with us in university. And the way that we tend to work that is in blocks of either theory or clinical practice placement. It works well for our students because it means you have the opportunity to really get your feet under the table when you're in practice and spend a number of weeks out in a practice team. And then when you're back in university, you have some time to catch up with your colleagues, to catch up with us within the department, and sort of consolidate your learning and assimilate the experiences that you've had in clinical practice. We operate a spiral curriculum, so we introduce learning to students right from the very beginning, and then as they go out into practice and they can assimilate those experiences, come back to us and we revisit that learning so that it becomes embedded. We don't believe in superficial learning. We want to create a lifelong learning that is deep and meaningful for our students. So we make sure that you're ready to register as a midwife by making sure that we follow the NMC guidelines, and ensuring that you spend 50% of your time in university, 50% of your time in practice. The Nursing and Midwifery Council, who is our professional statutory and regulatory body for midwifery, writes the standards for midwifery that you can find on their website, and they very much determine what we must include in our curriculum, and we work closely with them to make sure that when our students are ready to register with the Nursing and Midwifery Council, they've achieved everything that is required of them. And we work really closely with our practice partners. We currently have 5 NHS partner trusts who work with us, and our students spend time with them out in practice. And I'll talk to you in a minute about who those partners are. But we work really closely with them through the design and delivery of our curriculum. We're so lucky that midwives in practice sometimes are able to come in and support us, not just in interview, but also in teaching, so that we can really demonstrate to our students that we are a whole community of midwives, and we work together to make sure that you are ready to join that community at the end of your program. So your learning experience is hopefully exciting and different and something that will keep you inspired about midwifery as you progress through the 3 years. As I've already mentioned, we utilise an inquiry-based learning philosophy, which is a student-led curriculum. And I've explained a little bit about that. Our students are given a trigger at the beginning of the week, and that will generate discussion and debate. Students in their learning sets will take the opportunity to decide on some questions that they want to answer. Then over the course of the week, that will be done with our support. And as you can see from these pictures, there's lots of different ways that we can support students' learning, not just in the classroom. We also have interprofessional learning with the University of Bristol. Our students have the opportunity to work with 4th-year medical students looking at management of obstetric emergencies in a hospital setting. We use different types of simulation. We've got a picture here of students learning about breastfeeding using dolls, right up to students learning about delivering critical care. And our students obviously spend time in placement. We make use of online and digital learning resources to support our students. And we try and become involved in international collaborations as well. So we've had situations where students are able to talk to student midwives from all around the world, really sharing that community of learning and that community of midwifery. And I'm sure that you're thinking, will I be supported whilst I'm at UE? Will I be supported on this course? Midwifery, can be a daunting prospect. It's a very responsible job, but it's incredibly exciting and a wonderful privilege to be able to be with somebody as their midwife. And we provide a huge amount of support to our students as they go through the programme. Students are mentored in practice by clinical midwives. All students have an academic personal tutor who is allocated to them at the beginning of their programme and stays with them across the whole 3-year period. And they're there really to support them with study and academic skills, and also to signpost them to any pastoral support that they might require. The midwifery programme has a named lead who students can access, and each of the modules that they undertake will also have a named lead, and they will know how to contact that person if they need to have any questions or discussion about it. The PALMs are the Practice Associate Lecturers in Midwifery. Each member of the midwifery teaching team at UE is linked to one of our practice partners, and it will be one of those people linked to your placement area who is your academic personal tutor. So you'll be able to meet with your academic personal tutor either in university, or when you're in practice, they can come out and see you wherever you are on placement. It's a big university with a big amount of support. We have lots of student support services, including wellbeing. There's a chaplaincy department, of course. We have a practice support internet site and phone number for students when they're out in practice, if they need to make contact or get information, perhaps overnight or at a weekend. We have a huge library to support our students with lots of online content, and we try to make sure that all of the books that we put into our reading lists are available as ebooks as well as hard copies. There's a really vibrant midwifery society at UE, and it's something that you might already want to think about joining. It's not just open for undergraduate student midwives at UE. The society gives you the opportunity to access study days that they hold, taster days that the society hold, but also just to start getting to know, usually online, people who are applying for midwifery, who've been made an offer and who are studying as a midwife, or maybe have graduated from UE. So it's a really great way to get in touch with people who are thinking the same way as you and might be able to answer some of the questions that you have about what it's like to study and live with us here at UE in Bristol. So I said that I would talk about the primary placement areas, and you can see here on this map we've got 5 different placement areas that support our education here in Bristol. For those of you who are familiar with the city, we have 2 trusts in Bristol itself. So the red area on the map is North Bristol Trust, and for those of you familiar with Bristol, that's South Mead Hospital. The purple area below that is St Michael's Hospital in Bristol, and that goes right down to Weston-super-Mare, so it covers a slightly larger geographical area. The green area is the Royal United Hospital in Bath and their outlying community areas. The larger bluey teal area is Swindon, so that's Great Western Hospital and their large community area. And then the largest geographical area by far is the area supported by Gloucester Royal Hospital. You can see that geographically it's huge. The community support goes right out into the Forest of Dean. The way that we operate our placements with students is we make sure that you've got plenty of information about our partner trusts. Once you've received an offer from us, about 2 to 3 months before you start studying with us, we'll contact you with information about these 5 different areas, and we will ask you to select the top 2 areas that you might like to have your placements in. We ask students to only choose one of the areas in Bristol, so essentially a choice of 4. We also ask for where you'll be living whilst you're studying with us in Bristol and any reasons that we might need to know about, for example, caring responsibilities. And then when we have the final list of who's coming on the programme, so right at the beginning of your course, we look at all of that information and allocate students and inform them immediately in that induction week. We've been piloting we piloted it a couple of years ago. We've been running it for a couple of years, and it's working really well for us. It's very satisfying for the students because generally people are always offered one of their top 2 choices for their placement area. So really, I don't have much more to say, but I will talk to you a little bit about applying to us, but I just want to say welcome to our community. You know, you're thinking about doing midwifery, and that's a really wonderful thing. And there's so many elements to that community. You know, there's our little community at UE, lots of midwifery lecturers and students who are really passionate about the subject and caring for women. And then we've got, you know, midwifery in Bristol in the southwest, in all our partner areas, midwifery in the UK. You know, such a vibrant, exciting community to be part of. And then, of course, the global community. You know, women have babies all over the world, and midwifery is something that unites us as women and midwives. It's just a wonderful community to be part of, and I'd really like to welcome you at the beginning of your journey to working with us. And you can see some of our pictures of some of our students here, our Twitter account. You know, we really try to make sure that we stay in touch with all of our midwifery colleagues, both near and far. So when you're thinking about the future, you know, it's really important to remember that there are lots of options for you. Probably you're not really thinking past that registration as a midwife, or maybe even coming on the programme. But there's lots of different directions that midwives might go in. So thinking about NHS management, education, teaching midwifery, working abroad, working in clinical practice, working as in a specialist role, for example, maybe caring for vulnerable women or women with diabetes, working within research. 99% of UE nursing and midwifery graduates are in employment within 6 months of finishing their programme. So you can see that this course is really designed to get you out there into clinical practice as soon as you want to. So thinking about applying to us here at UWE, we operate a values-based recruitment program, and that's in line with the values of the NMC Code and also the NHS Constitution. So we're not looking for the skills that you can already do. We're looking for who you are. We're looking for those values that are so important for midwifery. We're looking for compassion and kindness and good communication. We're looking for who you are, and then we will be able to sort of teach you those skills as you come along the journey with us. So if you're thinking about applying, then we obviously all of our information is on the website, but our tariff is 128 UCAS points or equivalent. We do look for some experience in health and social care, and we understand that that can be really challenging to access, particularly within maternity. It's quite highly sought after. And we're certainly not looking specifically for maternity experience. We're just looking for any experience that you might have had within that health and social care spectrum to demonstrate that you have an understanding of how that care delivery looks, that you have an understanding of what it means to work with people who might be vulnerable or might need looking after, or need information imparting to them. We just want some examples of some experience. It can be paid or voluntary, and there's no specific time scale. So we have people applying with all kinds of situations that they've been involved with, perhaps working as a healthcare assistant, working in a care home, doing some volunteer work on a maternity ward. We've had people who've done participated in A&E Friends schemes and supported people waiting in A&E. We've had people who've supported community postnatal groups or breastfeeding groups. So really, the scope is very wide, but what we're just looking for is that understanding and experience of that health and social care provision. In your personal statement, when you apply to us through UCAS, we're looking to understand that you have an understanding of midwifery philosophy. So we're not looking for a list of tasks that midwives do. We don't need you to tell us that, but we just want to understand. What does midwifery mean to you? We want to know how you feel about it in terms of a woman-centered profession, and we'd like to know why you want to be a midwife as well. And also thinking about transferable skills and attributes that you might be able to bring to us and how you've achieved them. Have you had a part-time job or a club at school or college that you might be able to talk to us about on your personal statement. We do read a lot of personal statements, and so my best advice to you with regard to writing it is just be yourself, let your voice come through, be true to yourself and sell yourself. Don't let anything go unsaid, we read as many as we possibly can. They come through to us from the admissions department, and we're really looking forward to being able to offer you an interview. So I think I've finished talking to you. I'm sure that's enough. I'm sure you don't want to listen to any more. But simply to say that it's such an exciting beginning to your journey, and we absolutely cannot wait to meet you when you get started.